Come in.
Good morning.
Hi.
My name's Donald. I'm a nurse anesthesia resident from USN.
Nice to meet you.
Can I look at your armband?
Sure.
Can you tell me your full name and your date of birth?
Michelle Lewis, 12/16/62.
Okay, very good. I'm going to be doing your preoperative assessment today and do a full head-to-toe physical assessment.
Okay.
What kind of procedure are we doing for you today?
A colonoscopy.
Okay. Have you done your bowel prep? Okay.
Yes.
When's the last time you had anything to eat or drink?
Last night, about 8 o'clock, I did take my metoprolol this morning with a sip of water.
Okay. Do you take that once a day or
Twice a day.
Okay. Are you allergic to any medicine?
Just sulfa.
Okay. Ever had any surgeries before?
A couple of C-sections.
Okay. Did you ever have any kind of complications from the anesthesia?
Just some nausea and vomiting, but I think that's unfortunate.
Okay. What about any family members
Mm-mm.
have trouble with anesthesia
No, sir.
that you know of?
Mm-mm.
Okay. Do you smoke, drink, any kind of illicit drug use?
I enjoy a glass of red wine occasionally.
Okay. What about as far as your health history? Like, you have high blood pressure?
Mhm. Well, more of a high heart rate,
Okay.
but it's controlled with the beta blocker.
Do you see a cardiologist or just a family health
Just
doctor?
family.
Okay. Are you having any kind of chest pain, shortness of breath
No,
this
sir.
morning? Okay. What about any kind of lung diseases like COPD, asthma? You don't take any kind of inhalers? Sleep apnea? Okay. What about, you have any trouble with reflux? Okay. Do you have any kind of blood diseases like anemia?
sir.
Nothing like that. And what about, ever had a seizure or a stroke before? Okay. What about anything like depression, bipolar, nothing like that? And do you have diabetes? Thyroid problems? Okay. I'm going to go ahead and I'm going to go over here and wash my hands right quick, and then we'll go ahead and start with your physical assessment.
Okay, great.
So, go over here and wash my hands real good. Okay. Alright, first thing I'm going to do is I'm going to start to feel your head for any kind of masses or lesions. I'm going to feel your lymph nodes. You ever had any problems with swollen lymph nodes? Or?
Just occasionally when you get a cold, but nothing chronic.
Alright, do you have a cold or any kind of sinus trouble right now?
Nope.
Alright, I want to do my neuro assessment. I'm going to get you to look at my pen light. Okay. And I'm going to get you to follow my finger. Okay. And down, back up, and back. Okay. Now, I'm going to get you to take some nice, good, deep breaths for me. I'm going to listen to your lung sounds.
Okay.
Take some nice, good, deep breaths. And again. Okay. Now I'm just going to listen to your heart and make sure you don't have a murmur, anything like that. Okay. I'm going to check for symmetry of your chest. And just take some nice, good, deep breaths for me. Okay, again. Okay. get you to take my hands and push them apart. Okay. Now push them together. Okay. And I'm going to get you to lay back for me. Okay. And I'm just going to check your pulses. Okay. They're strong and bounding. Check your popliteal. Check your pedal pulses. Okay. And one thing I'm going to get you to do for me, I'm going to do your airway assessment. Can you open your mouth real wide? Okay. And stick your tongue out. Okay. And I'm going to get you to protrude your lower jaw. Okay. Just check and make sure you don't have an overbite. Okay. And I'm just going to check your thyromental distance, and that looks good. I'm going to listen for bowel sounds. I'm just going to percuss the abdomen. Have you had any abdominal tenderness, nausea, or vomiting, anything like that? Okay. And I'm going to get you to push against my feet. Okay. And then push back against my hands. Okay. And that concludes our physical assessment. Is there any questions you have for me? Okay. What we're going to do is we're going to give you a little bit of medicine through your IV, kind of get you nice and comfortable. We'll take you back there, and you won't know anything once they start to put the scope in. The procedure will last for about 20, 25 minutes, and then you'll wake up in recovery. So okay. I'm just going to get you to sign the consent form for me.
Okay.
And we'll have you roll back there shortly.
All right.
Uh-huh.
Thank you.